we're going to go into Mosaic Life Care to talk about nursing at all different levels. So let's zoom into the western part of the state to see some of the great occupational pathways and how action-oriented people want to make a difference in saving lives as they consider to be a nurse. We're going to look at nurses' assistants, licensed practical nurses, and registered nurses working hand in hand with surgeons, doctors, and a ton of healthcare providers each day. Let's see what it's like to be a nurse at Mosaic Life Care.
If I could talk to my high school self or somebody that's in high school about why they should become a nurse, I would tell them if they want to make a difference in lots of people's lives, if they want to give people hope and give people happiness, then become a nurse. So when I was in high school, I went to Savannah High School and they had a program there called Health Occupations. So my junior and senior year, I did that. And we got to go to the local nursing home and get our CNA the first year. And then the second year, I got to work at the med clinic in Savannah for half a day. And so I didn't have any nurses in my family. I was kind of the first one to decide I wanted to jump into healthcare. My dad fixes cars and my mom does insurance. So it was a kind of a new thing, but I loved it in high school. So I knew I wanted to be a nurse then. So I went to Missouri Western here in town and got my nursing degree there. We did a lot of clinicals here at Mosaic, and I'm a local girl anyways. I've always lived here, will probably always live here, and I enjoyed my clinicals at Mosaic. It's a great hospital, lots of opportunities for growth, and I just felt like I fit in here. Mosaic has a great work environment. I think it's a very healthy work environment. I'm happy here. We have good benefits, we have good leadership, we have good people. We have a great physician to nurse relationships. You know, everybody treats each other with respect. The community keeps me here. I'm from this area, so of course this is home to me. So a typical day for me lately is I come to work and we do report, and all of our patients are COVID patients right now, which is what I've taken care of for the last 2 years. So I really feel like I have a lot of knowledge towards those patients. But a typical day would be gearing up, putting on my PPE, going and seeing all my patients. We spend a lot of extra time with them, I think, because they're not allowed visitors for the most part. So we get to know these people, and also their length of stay is a lot longer than a normal like surgical patient or something like that. So I spend a lot of days or a lot of time in my day just talking with my patients and getting to know them and learning about their family and where they're from and people that they're missing while they're here at the hospital. I think that the nursing field is a wonderful job or profession for anybody that's thinking about nursing. I think if they honestly love people, you have to love people, you have to love to take care of people. It's not an easy job at all. It takes a lot of work, it takes a lot of heart, it takes a lot of commitment to your patients and to your fellow coworkers. But if you really want to help people, you want to make a difference, nursing's a great field. You will always have a job. The stability is there. You will always be needed. And you could go anywhere, even within the organization. If you could move around to different units or different clinics or things like that, and then you could go anywhere in the world as a nurse. It's always going to be a stable profession. You're always going to be able to find a job, and I think that is good. Being a nurse allows me to change lives. Being a nurse allows me to help people when they need it the most. Being a nurse allows me to save lives. Being a nurse gives me purpose, I think, too, as an adult in this stage of my life. This gives me a purpose outside of your mom or your whatever else. Like being a nurse, it's a different hat you put on. It's a different person, and you're able to help people when they need it the most.
You know, a lot of you young people right now are thinking about, could I be a nurse, and what it would be like if I were a nurse in today's healthcare profession. Well, if we look at the state of Missouri, the numbers for nursing have gone up. Just in January, there was over 6,700 open nursing positions around the state of Missouri. So great, viable career. We're going to zoom in live with Ashley White and Dominique Bigelow from Mosaic Life Care. Ashley, welcome back, and Dominique, welcome again to 2023 Healthcare Career Day. The operating room is yours. Can you go ahead and unmute?
There we go.
All right, awesome. We got you.
All right. Well, thank you guys so much for having us. It is an honor and privilege to be with you all today. My name is Dominique Bigelow. I am the nurse recruiter for our 3-hospital system, Mosaic Life Care. We have a campus here in St. Joseph, Missouri. We also have a hospital in Maryville, Missouri, and in Albany, Missouri. So we are a pretty big health system, and we're excited to talk to you about some of the opportunities that nursing has at all of our facilities. And I am joined here, as you guys met Ashley earlier, and we're just going to talk to you a little bit about Mosaic and what organization has to offer in regards to career pathing and really how to get started. And so really to start out, you know, nursing, like Ashley said earlier, it is an amazing profession. And especially here at Mosaic Life Care, that has been the reason that I have stayed here at Mosaic, because there are so many opportunities within the nursing profession to grow your career in so many different ways. But the nice part, especially if you're in high school, there's a lot of opportunities nowadays to get in and start shadowing other areas, whether it be with nursing, radiology, respiratory therapy, any of those areas. We offer a lot of opportunities for high school students, even college level students to come in and shadow just to get your foot in the door and see if it's something that would interest you. And then I'll let Ashley just kind of talk again a little bit about her career path and how she ended up as a nurse, and then I can go back through mine as well.
Sounds good.
So as I said earlier, I kind of told you my story on how I became a nurse. I've been at Mosaic Life Care for almost 14 years now. I worked at the bedside the majority of that time. And to talk a little bit more about growth, is I was a bedside nurse for 13 and a half years. And I recently kind of transitioned into an associate director position on the same unit that I've always been on. That's my home. I love it there. And so I think there's lots of growth that can happen within nursing, and that's definitely what I've been doing. And it's a wonderful career. Healthcare is a wonderful thing that you can make the most of.
Yeah. And that's a really cool thing. A lot of the things that you're doing in high school are translatable into the healthcare field. You know, growing up in high school, I loved being on committees, and I loved the idea of bringing new ideas and helping just elevate everything at the school, even whether it was through sports or cheerleading or debate team. All of these teams that I worked on, we were always working on a project that would help make the organization better. And in healthcare, you get to do the same thing as a nurse. It's very translatable. So whenever I started out as a nurse, I actually started on our cardiovascular thoracic unit. And I started out taking care of our post-open heart patients. So these are patients that have had some sort of, heart attack or something of that, and they actually had to have surgery done to correct that abnormality. Well, then they would come up to our floor the day after surgery. And it was a very sensitive time for those patients. They are on a lot of medications, a lot of drips, and there's a lot of protocols that you have to follow. But there's also, with these patients, a lot of research and development that's out there. And so it's really nice taking care of those patients, because at the end of the day, I always felt like, man, that was awesome. Like, I managed that patient. I was able to keep them stable all day. And as I began to progress in my career, I was reading the research out there and seeing what other opportunities were available to help take better care of patients. And so I essentially started doing the same things I was doing in high school. I started promoting these ideas to my leadership. And that is the most amazing part about Mosaic, is that our leadership really listens to our frontline caregivers, and they listen to the ideas we have, be that they're crazy or not. They're going to listen. And, they put action behind those ideas for us here, which is really neat, because then as a nurse, you're getting to innovate from the bedside level, which is really cool to help improve patient outcomes. So that is my favorite thing about Mosaic, is that, our overall just committee status. We have what's called a shared governance council as well. Do you want to speak to how shared governance has worked on your unit and some of the things you guys utilize that for?
So the shared governance has nurses from different units that are able to work together to improve how things work on the units and how we take care of patients. And I know that as it's begun, they've had several meetings now, and they've really been able to speak to what would make their job better, what would make their life better at work. And I think it's been fantastic. I think it's really given nurses and PCAs and everybody a voice. And it seems to really be making a difference on every unit, I think.
And that's also the really cool thing. You can start as a PCA and come in and begin to have your voice heard right away. If you're noticing things on the unit or things that you would like to adjust or change, we have leadership here that is very integrated and involved in our care, and they listen, and it's amazing.
That's great. And that actually ties into a question we have coming in. So right now, I believe we have Catherine Bentley, who's going to go live and ask a question. Catherine, are you there?
Hi.
Hi, Catherine.
Sign me in as a panelist. All right. So I'm coming from Hazelwood Central High School in the St. Louis area, and I have a student who'd like to know how much schooling you need in order to become a registered nurse.
Most definitely. My number one recommendation, you are in high school, you can get started now with those college level courses if they are offered at your school. But you can there are programs like the associate's degree programs that you can enter in really straight after high school. But you can actually begin to take those college level courses in high school so that you're already getting a head start into some of those associate degree programs for nursing. And those programs, you can, move through them. There's several stepping stones, like we mentioned. You can start as a CNA. While you work as a CNA, you can qualify for tuition reimbursement and begin the RN program. That RN program takes anywhere from normally around 18 months to get completed. And then after you complete the RN program, or the LPN program, you can bridge over to an RN program. So you really can become a nurse within a couple years after graduating high school, which is the really cool opportunity that not a lot of high school students know. There's several great associate's degree nursing programs in Northwest Missouri. We have great partnerships with North Central Missouri College is a wonderful one that we recruit from quite frequently. But I would take a look, especially if you're in high school and you're wanting to hit the ground running as a nurse. Take a look at some of those associate's degree programs, because you can always bridge over to obtain your bachelor's degree within 2 years.
Fantastic. We have one more question coming in. Hancock Place High School would like to ask a question live. Hancock, if you could go ahead and turn on your video and your microphone and unmute. Good morning. Welcome to Healthcare Career Day.
Hello, my name is Bishop Brady, and I was wondering, what is your typical work schedule as a nurse?
So we offer a lot of flexibility here at Mosaic. Our nurses are able to self-schedule. So you actually get to pick your schedule, what days you want to work. Normal full-time nursing is 3/12s a week. We do, have weekend requirements because a hospital facility is, 24/7. We don't stop, so we have to be here on the weekends as well. But you are able to select the days that you want to work here at Mosaic, which is really nice for your work-life balance. But we also offer things like part-time positions, which would be 2 12s a week. But then there's some nursing positions, like if you move on and you want an 8 to 5 job, we also employ LPNs in our clinics, and those are going to be more of a Monday through Friday, 8 to 4:30 or 5. And then we have like our urgent cares that you can go work at, and those have very similar clinic type of hours. So there really is a wide range of availability for shifts, which is really conducive to that work-life balance.
Fantastic. We have one more question coming in from Southeast Missouri. Portageville students want to know from Portageville Elementary, how do nurses know what to do at any given time?
We receive a lot of training, and we are continual learners. It doesn't stop when you graduate school. I still learn every day, and I know Ashley does too, even in her leadership role. But we still both work on the units, and we're still wanting to continue to develop our education every day. It doesn't stop with one profession. There's a lot of advanced certifications that you can attain as a nurse, which is really cool. And so if you get into a specialty and let's say you love critical care, there's a critical care specialty that you can obtain as a nurse. And then you can become subject matter experts in that area. So we never stop learning, but there's always room for, those advanced certifications and growth.
That's right. Continuous growth. That's all what it's about. And these students are getting a chance to learn about what you do in your pathways. And thank you so much, Dominique and Ashley, for zooming in from Mosaic Life Care in St. Joseph, Missouri. And thank you for being a strong supporter of Missouri Healthcare Career Day.
No problem. Thank you guys so
Thanks
much.
for having us.